Hi, thank you for watching my channel. Today I want to talk about panic attack. Panic attack is something that's really scary and it comes pretty sudden. And you never really know like when. And um, my experience with panic attacks are very hard. That Last year I actually had to go to emergency room, which I think it was not really necessary. um, Basically I got yelled at by my boss at the time, and since I have trauma with men, um, I started to hyperventilate and then I couldn't breathe, and then I was just so getting panicked. So I decided to go to emergency room, and at emergency room my experience was horrible. They took my blood, and then they did such a bad job that I got bruised for like a week after, and then they just took like EKG, and then um, they tried to give me medicine, but I refused to take medicine because I don't like to take medicine. So they really didn't do much. Instead, they just charged me like $3,000 for 4 hours emergency room visit. So that was kind of stupid. I shouldn't have gone to emergency room for panic attack. But when you are in the moment of doing getting panic attack, you just can't think straight, and you just think it's gonna be end of your life. So my advice is that one of the advice that was helpful from the counselor was to say the date and time that you are in right now. So for instance, you just say the name, your name, and then where you are, and then what's today's day and what time, and those are the realistic thing that can ground you from the panic attack. Panic attack is something that basically your brain is fired up from the trauma, and then you can't think straight. So basically what you can do is to say as realistic things as possible, say even like some object that you are holding, and then you try to describe, and that's actually DBT, directive behavioral therapy. But you can just hold something and then try to describe everything about that object, or just say your name and date and time, um, what you're doing right now. Because most of the time my panic attack, my personal panic attack, is that something happens, and then it brings back to my childhood's um, abusive experiences, that the trauma that I had, and then I feel like I'm in that moment um, still, and I can't change it. But the fact is I'm already 38 years old. I'm not 8 years old. That's a fact, but I can't think of that way when you're getting panic attack. um, People told me about the paper bag, and then just breathe in and out with that, but I've never actually tried in my life. um, One thing I definitely tried is to say the date and time, and try to breathe. But the funny thing is, after I went to the emergency room last year and then got charged for $3,000 for hospital visit, I haven't gotten much panic attacks since. So it was really bad experience. But at the same time, that is the most realistic thing. That, oh, if I get panic attack again, then I would have to maybe go to emergency room, and then I would get charged for $3,000, and I don't definitely want to do that again. So that kind of helped me to overcome panic attack. But that is just my personal experience about panic attack. But before that, like, I used to call my counselor like midnight, like, or like 2 a.m., and I try to like I really wanted to kill myself, and I just wanted to like end this pain. But one of the book that I read, one of the phrase was, think about panic attack is like a labor or contraction, which I had experienced. And then it actually gets really bad, and then it gets no pain, and then it gets really bad again, and then no pain. So it's almost like going through the pain, but knowing that there's gonna be no pain after this, so it's not gonna last. um, I would say it depends, but like, it feels like it's a long, long, long time when you are getting panic attack. But just um, it will all depends on the personal experience. But I really encourage you to think that after this panic attack, it's gonna be normal. It's not gonna last a long time. It's not gonna kill you. It's definitely not going to end your life. So you need to really have courage and wisdom that it's gonna be okay, and then just really tell the date and time and your name and where you are, and that seemed to help me a lot. So hopefully that would help you too.